why are women choosing breast lift surgery? And I'm going to guess something here. Is it simply perhaps that they don't want to, or they have the option of not having a foreign object placed in their body?
I think it's both of those things. I think women are, there is a general trend overall towards smaller implants and even, no implant at all, and just restoring the shape of the breast with a lift procedure. So I think there's more awareness of that, of the potential to achieve the result you want with a lift alone. And I think women in general are trending toward preferring smaller implants or maybe no implant at all.
Okay, so let's talk about breast augmentation again. You have someone who comes in and you're looking at candidates because, of course, you have to talk to everybody. They come in. Who is that good candidate? Describe it, if you will, for me, for augmentation.
Right. Well, if the patient specifically wants a larger breast, I mean, that's the appropriate candidate for an augmentation, either with an implant or with fat transfer. And we'll have that discussion at that time as far as implant, type of implant, incisional approaches, and the volume. And we'll spend a lot of time sizing with that patient. So we measure very specifically the dimensions of the breast. We'll consult with the patient and find out how many cup sizes larger they wish to be. We'll do sizing with sample implants and devices that are specifically designed to give the patient an example of what their result will be with a specific implant. And we have software available for that also that can specifically give a patient an image that will be close to what their final result will be with a specific implant. And then we'll help select the implant for them.